All right, I'm a little bit tall, so I'm going to hold this out in my hand. Um, Hi, everyone. Thanks for joining us for this session. We're going to talk today about quantifying DHIS2 impact, return on investment. So what is this session about? This is being driven by, I think, an increasing need to justify the costs and understand the costs of DHIS2 and DHIS2 systems, which is obviously coming in the context of reduced budgets, a tighter financial landscape in which we're all operating. And because of that context, there's more expectation that we'll be able to, like a normal sort of business, explain to people how much the software costs to produce, to use, and then what the concrete benefits of that use are. So I think we're going to have a few presentations today to talk about that from different angles. So obviously, when you're talking about return on investment, you're talking both about the cost of something, the investment that has to go into it, and the benefits that come out of it. And so I know that Scott will talk about this a bit from the country level perspective and the GPG perspective. And Basoye from BAO Systems will talk a bit about approaches to managing costs of these systems and how to potentially reduce them so you can get more cost effective and then make your ROI better as a ratio of investment cost to output. So with that said, I'm going to turn it over first to Scott, then we'll have Basoya next, and then I'll speak a little bit at the end. So Scott.
Okay, thanks. Don't be shy. You can hang out here. This session's fun. We can talk about AI if you want. Okay. So let me just introduce myself. I realize that I often don't do that. So I'm Scott Patrick. I'm a senior advisor here at the HIS Center, focused on platform collaborations, partnerships, and trying to get a little bit of a grip on the broad DHIS2 ecosystem. And so a big part of my job now is basically talking to people about why they should care about DHIS2, why they should care about DHIS2 continuing to exist. And oftentimes now, increasingly, what even is DHIS2 and what is the value proposition for engaging in the DHIS2 platform and to its broad ecosystem of contributors, collaborators, HIS groups, ministries. It's actually really fun to talk to people who have no idea what DHIS2 is. Do you guys ever do that?
Yeah.
It's a
Yeah.
it's and then you say things like it's 130 countries, it's nearly 4 billion people, and they're like, how the hell did I not know about this? Especially when you go to like the US or high income context and you say that kind of thing, and it's just like, what? And then you start, and then they say, okay, so like, yeah, what's your budget? How do you do all that? And they're literally expecting us to come back with like billions of dollars, right? And it's not that. It's definitely not that. So it's really important for us to be able to communicate this and then also show, okay, yeah, but with the budgets that we have, here's what we're actually able to, here's the value of investing back in it. And more importantly, engaging in the broader ecosystem and opportunities. So what I've tried to do is just, where am I? I'm over here. What I try to do is boil it down to just like 7 key points. So if you're ever talking to someone about why it's worthwhile engaging in DHIS2, collaborating in the ecosystem, what's it in it for them? I try to boil it in down to like 7 key points. Very high level, hopefully quite simple to process. So the first one is, okay, great. I've got a solution. I've got an idea. What can DHIS2 give me? Right? So say I have a new innovation, a new application, or say I have like a new idea about how we're going to monitor diabetes or tuberculosis or that kind of thing. What is DHIS2 able to provide? If I invest in DHIS2, what does it give me back? Well, the simple answer is, again, DHIS2 is used in a ton of places. 130 countries, some kind of implementation, 80 countries at national scale implementations. So if you invest in DHIS2, you put your products in DHIS2, you put your insights and knowledge in DHIS2, you immediately go to you can immediately go to massive scale, right? That's just building on top of our established network already. Good example was the COVID-19 pandemic. So COVID-19, one country, Sri Lanka, did the primary innovation there in DHIS2, posted it on the community practice, went to over 60 countries in a few weeks, right? That's the kind of rapid scale that can be possible. That's extremely unique, right? And just through a post on a community practice, something goes to that kind of scale, right? This just doesn't really happen. And I think in the DHIS2 world, we're like, oh yeah, that's how it works. That's not how it works most places. Reduce fragmentation and cost. So in most of your countries, in most countries implementing DHIS2, they're not implementing DHIS2 just for one program. They're implementing DHIS2 for a lot of programs. And then a lot of these programs are integrated into one central DHIS2 instance. As I'm talking to people in higher income contexts like the US and Europe and Central Latin America, I'm realizing that this is actually not that normal. Most individual programs have their own information systems, and they spend a ton of money on that. DHIS2 is actually extremely unique in that we have, like in this example of Sierra Leone and many other countries, we have HIV, TB, malaria, and logistics all in one database. When you tell that to people who are not used to DHIS2, they're like, how did you get that all in one place? That's insane. Those things are all completely different. How do they fit together? Right? So this is not normal, and we need to appreciate that. And so when you say you invest in DHIS2, right, you're saying you're investing in a platform that can give you a lot of things for one investment, right? You can get all these programs at one time. Reliable data for strategic decision makers. So this is kind of targeting the donors, the higher level multilaterals. Yeah, I mean, like I said, DHIS2, 130 countries. Most of the KPIs are going to come from DHIS2. So if DHIS2, if you invest in DHIS2, you're investing in your own data sources, right? That should be pretty straightforward. Although an argument that you continually have to make. You have to prove this over and over and over and over again. But it's still there. So without DHIS2, multilaterals struggle to get data. Bottom line, they need to invest. Local capacity strengthening. So again, this kind of goes back to my first point. If you have a cool idea for DHIS2, like UNICEF is a really good example of this right now. So UNICEF came up with an idea of building a really cool maps training program, right? How do you distribute improved utilization of GIS and spatial analysis, not just within DHIS2, but generally? Package it up into DHIS2 because we have a distributed network of you all and tens of thousands of others who are able to immediately pick that up and run with it, right? So, and this network, this community that we have, also not normal. It doesn't happen. Why are the other DPGs here? It's because they don't have this, and they want to build on top of this. They want to utilize this. And so when you say, okay, let's do this in DHIS2, you know that you have an audience already, right? You have people who are going to immediately be able to take it up. So, and that's because of all of this local capacity that's been established over the last 20 years. Reusability of digital public goods. So digital public goods is a big buzzword these days. DHIS2 is a digital public good. We're very proud of that fact, and we work very hard to maintain it. And that means that we are able to be reused over and over and over and over again for some of our modules. So if you're multilateral, or maybe say like I'll keep mentioning Diabetes Foundation, right? World Diabetes Foundation. You say, I want to make a new guidelines for diabetes surveillance. Great, put it in DHIS2, and it connects to all the other DPGs, and then you can distribute around the world. Yeah, so you make one investment to make it work in DHIS2, it gets spread around through the DPG network. Alignment with digital global architecture or global digital architectures. This is a huge one. So people are always asking, how does DHIS2 play nice with some of these like modern buzz terms and architectures and that kind of stuff? The reality is we do try to align with basically all all of the global standards. So we're in WHO, global standards, GovStack, the DPG Alliance. So what happens? We're basically saying if you invest in DHIS2, you're investing in something that is robust, that fits within digital architectures, national architectures. And it's going to continue to. That's the important thing. It will adapt and update itself to make sure it continues to. So your investment is never lost, right? It'll just continue to be updated. And then, of course, equality and inclusion. Probably one of the biggest things about what we're trying to do with DHIS2 is that this is kind of the kumbaya story. You invest in DHIS2 because you know it is a global good and that it's serving a community who cannot invest in things, who's underserved, who will not be able to afford quality digital services. So without a licensing fee, right? And this is also, as I'm talking to other platforms and going around the world and talking to other countries, the very first question is, this is amazing, how much does it cost, right? They want us to tell them a licensing fee. In fact, some high-income countries are just saying, like, please just give us a licensing fee. Just give it to us, because that's how our procurement systems work. And we say, we don't have it. And we're not only don't we have it out in terms of, like, we can't actually invoice things like that, but we don't have it out of principle, right? And the reason we don't have it out of principle is because if we put it for some people, then how do we just, I mean, it should be available to everyone. It does make a bit of a problem when you have an institution that really wants you to pay a licensing fee, and you can't. You can't physically, you can't actually get them to do it. So, yeah. So I mean, in a nutshell, this is it. And I just wanted to drive the point home. You know, in 2020, Gavi's made a lot of investments over the years, of course. But we focused on immunization modules in response to COVID. And again, that was uptaked by over 30 countries. Imagine if Gavi had to invest that much money into each of the countries, right? The efficiency gains are insane. We save millions of dollars not having to go country by country by country by country by country. You invest in one platform, everybody has that platform, immediately gets distributed. You have incredible return on investment. Okay. And then I think with that, of course, I always have my little pitch at the end. If you want to work with us more, which hopefully you all do, please communicate. All right. Then I think I'll give it over to Basoya.
Thank you for the clap. Thank you.
Yeah, thank you. Yeah.
That wasn't for you, Scott, I guess.
That's all right.
No, my name is Busoye Anifalaje. I president and one of the co-founders at BAO Systems. I'm based out in Cambridge in the UK. And I would be talking today more about the cost implications of running a system like DHIS2, especially over time. And thinking about this, I felt it's an afternoon session. How do you draw the point home? So the analogy is, as it is with life, it is with technology. So consider yourself a single person, your cost fairly predictable. You can control it. Maybe you go for dinner out once every 3 months. And then you meet someone, and then it's date night every other week. And then you decide to buy a house, you decide to have a family, and the children grow up, and you need to feed them, and they like music lessons, and they want an education up to university. I'm not griping, this is not my gripe, but cost spirals over time, and there's really nothing you can do about it until the point where you think, actually, this is out of control. Maybe we don't have to go out for dinner every weekend, and maybe piano and violin is too much. Maybe they just do one instrument. And this is what we find with DHIS2. Like, over time, what we see is, because of the versatility of the platform itself, it works really well and across so many different sectors and so many different use cases. people keep building the HIV program, the immunization program, the TB program, and like, oh, you know, we can do a lot more with maternal health. And so these systems tend to grow and grow and grow and grow, and there are cost implications. A few years ago, Jorn actually talked about the challenge of maintaining the metadata over time. That when you have 10 years worth of data, it's a little bit difficult to maintain your metadata. But now with funding costs, with funding changes in the funding landscape, it's not just the technicality of maintaining the system that's now an issue, it's actually the cost that comes with that maintenance. And so we will look at like a few examples of what that looks like in real life, and then some of the things we have been doing with our clients to help them actually save costs at this crucial time. So we have about 5 use cases to go through that. So 2015, DHIS2 is used. A lot of the international implementing partners start to use it. PEPFAR adopts and grows exponentially in use. We see expansion in 2018. DHIS2 at scale in 2021. It continues to grow. A lot of tracker programs, which is a game changer in terms of the volume of data that goes into the system. And by 2025, what we're seeing now is these systems are now actually being bogged down by performance issues. Queries aren't running as efficiently. I think, was it last year or 2 years ago, that there was even, I don't know whether it was you, Scott, that mentioned this. Like, if your dashboards are not not rendering because you just got so much data, like use the first page of your dashboard as like an informational, so that you can see that. I mean, when it comes to the fact that you can't actually open your dashboard, it takes you 5 minutes. What used to take 20 seconds to open a dashboard landing page is now taking very close to 5 minutes. There is a problem with the system. The system is saying, actually, we're struggling in terms of resourcing the system. So 10 years worth of data, complex architecture, performance issues. Maybe some of you would resonate with this. But what you also find is with performance issues, you also have cost and maintenance resource implications. This is one of our clients. You can see within 5 years, 5.5 years, 1 billion data values. And the next 5 years, they almost double it to 2 billion data values. And that's not trivial in terms of the volume of data within one system. So what happens? You have slower systems performance. As your system grows, the time to load analytic dashboards, things like that, it's taking more time. You have to choose how to optimize the system. The system starts to crash. You have downtime. Bob was talking about, you know, if it's a critical system, if a system goes down, you get a phone call, like the system is down. But if the system is going down frequently, you almost compromise the, I guess, the legitimacy of the system. Confidence in the platform also begins to go down, and people do what? Go back to Excel spreadsheets. They're like, okay, at least I know that's not going to crash. But that's probably not even an option for most implementations these days. But there is a real risk of lack of confidence in the platform, and also disruptions to critical health services, especially if you're using a tracker program where you need to be capturing data sort of real time. So cost implications for increasing data in your systems, increased storage costs, increased human resource costs, as I mentioned. Now, solutions. So I'm going to go through 5 of these. What are the kinds of things that we're trying to do with our clients to help them reduce the costs? Focus on what do you need out of the system? And from your reporting and analytics perspective, what do you need? Start with this end in mind. What we usually do is, because sometimes it takes a lot of time before a contract is signed. And so by the time the contract is signed, you just want to capture everything. So you put everything in, any conceivable, possibly that we might want to use it. We may need to use it at some point. It only happens once in 10 years, but just in case this is the year it happens, we capture everything. What we really should be doing is looking at globally defined indicators. Like, what are the standards out there? And going from there, in terms of what do we need to come out of the system, what kind of analysis do we need out of the system, and focus on the most critical information. Is prioritizing the analytics that we want out of the information first, quality over quantity, outcome instead of output and process. So this use case, we had a client who had a very large tracker program, lots of data fields. And so what did we recommend? We recommended reduce sort of new fields, just use the aggregate instead. So don't keep adding fields to it. The result was implementation of the project itself was lower. The server cost was lower. In real terms, they saved $25,000 in the one-time implementation and $3,600 every year on what they would have been paying for a server by just saying, focus on your priority data items first and don't keep adding data to this. So that's excessive use of data, reduce that, consider using aggregate instead of, oh, do I get a time check? So I know how I'm doing. Thanks. So second is to standardize and align metadata. If you can reuse your metadata rather than the indicator definitions, if it's similar, if it's the same, if you can use one instead of 2 or 3, use one, standardize, use a metadata. And I think there's a lot of investment that have gone into creating these metadata packages as well. And have a governance structure, because some of the countries that we've worked with as well is all this is well and good. Without a governance structure that says how you actually deploy things to the system, and in the system, everybody creates their own thing and everybody has their own fiefdom within the system. And again, you get the problem of performance and a bloated system. So this use case was more of a large, complex HIV program. And they were working in multiple countries. To increase the complexity, we're actually collecting individual level data with key populations. And so I remember it was about 19 or so countries, and they had a different configuration for each country. So you can imagine at headquarters level trying to consolidate reports for PEPFAR every 3 months was a nightmare. We helped them develop a standard metadata package. We worked with the WHO. I think we might have even talked to the UIO folks as well. They deployed this across all their countries. It took some time. They were able to reduce their server size as well as the support needs. So in real terms, reduce cost of implementing by each country by 50%. We had some numbers there, but I wasn't quite sure that I wanted to show those numbers. So I just put the reduced cost by 50% was not insignificant. At the HQ level, because they were supporting all the hosting and servers for each of these countries, they were able to save almost $17,000 a year. These are real savings by consolidating, by looking at the cost structure and how you have over the years organically grown your system and trying to manage that growth. So next is to optimize your DHIS2 architecture. DHIS2 can do a lot of things. That is probably one of the problems of DHIS2. There almost seems to be no limit to what DHIS2 can do. And sometimes we really contort the functionalities and the features of DHIS2 to make it fit. You don't have to do everything through DHIS2, especially if you're looking at large, complex system. The developers have now built a really great platform where you can leverage microservices in the back end to be able to optimize things. So not everything has to be done through the system. Use native functionality as much as you can and do things outside of the system where it's practical to do so. Think of scale. As this thing grows, what's the most efficient way to be able to operationalize our features? The use case for this, a large NTD program had 12 event programs. And we know that there isn't a cross-program analytics in DHIS2 at the moment. So what did we do? We extended DHIS2 functionality using the analytics platform and a lot of those microservices back-end functionality. So a lot of things happening outside of DHIS2 being pushed back to DHIS2. what was the savings there? Well, first, increased system functionality because the system actually worked really well because it wasn't bogged down with all the processes of these complex calculations. But almost 17,000 again saved on server, and on the sandbox, because they also had a sandbox, about 11,000 saved every year. So if you're thinking your system is going to grow, if you're thinking it's going to be complex, these are things that you can put in place. Invest in solutions outside of DHIS2 that reduces the complexity that you put on the DHIS2 system itself. I'm almost done. Data retention policies. The fear of maybe it's missing out. Like we've been capturing this data for 10, 15 years. Do you still need that data to be operational in your system? So when you have a country that has, 2 billion data values, what proportion of those data values are actually operational that you need to be able to access going forward? So need to think about retention. Do we offload sort of like do we keep just the last 3 years, or do we keep just the last 5 years in our operational system and then warehouse the rest? And you can always call it back at some point. That's again something that we worked with the client on. A large DHIS2 system, 10 years running and having frequent performance issues. That was the problem. And the solution was archive historical data into another system, delete unnecessary or duplicated metadata. And by doing that, they were able to save about 5,000 a year. Last use case, the DHIS2 ecosystem itself, and developing a digital strategy. Multiple DHIS2 instances with varying alignment between systems is what we're faced with. You have multiple administrators because people want, the HIV person needs access to the system because they need to be able to control their metadata. The immunization person needs access to the system because so you have many administrators, and then you have custom indicators because they want it just so. They want it to be just like the program without any sort of reference to the entire architecture. So you end up with high cost in maintaining a centralized and decentralized administrative teams. And with reduced funding environments, support for having multiple administrators doing the same thing on the system is not going to be as tenable going forward. So what should we be doing? Identifying opportunities to leverage innovations to do more with less resources. And the use case here is we had an implementing international NGO that had 24 DHIS2 instances deployed across 12 countries. And so what did we do? We tried to do an assessment and create a comprehensive plan to align all their programs across all their countries, across all their instances, and think about a digital strategy for how they actually can consolidate across programs across countries. And by doing this, you reduce duplication across countries and across instances. You might even be able to dispense with some servers. And here, the result was more around the resources they needed to maintain their instance. So they reduced the number of DHIS2 instances, and by reducing the number of DHIS2, they went from 4 FTEs down to 1.5 FTEs. That, again, is massive savings, especially in these times where you have to justify every investment. So thank you very much.
Thanks, Messiah. I'm going to give our next presentation, and I'll start by introducing myself, which I realized that I had not done at the beginning of this session. My name is Max. I am the Communications Director for the HISP Center and the DHIS2 team. And you may wonder why the Communications Director is giving a presentation on ROI. I am not an economist, and I will not pretend to be an economist. But as was pointed out to us in a meeting with some other partners when we were discussing the concept of ROI recently, the reality is in our position and in our scenario, when people are asking us for an ROI on something, it's usually in an investor dialogue. And what they're really asking us for is to justify their continued investment in our work. And to that extent, it's partially an economic measure and it's partially a persuasive tool. And the reality is that a true ROI calculation is actually quite complex if you want to try to encompass all possible factors, all possible costs, all possible benefits. And most, okay. Try this one. Okay. So most of the time when we're talking about ROI, we're actually looking at a narrower selection of factors, and those that resonate most of the people we're talking to. Different people will be more convinced by certain kinds of value than others. And so it's important to know who you're calculating the ROI for, and that will affect, I think, what you emphasize in it versus not. So it's not just a pure science ultimately. It's also this kind of attempt to craft a analysis that resonates with a certain person, given that different people have different concerns and different ideas about what is valuable. We're going to get into that in a bit. So I'm going to talk a little bit about the abstract and a little bit about the concrete. There have been some attempts to calculate ROI of DHIS2 systems, and I'll share some of those because I think they're really interesting. And I'll also share a larger sort of discussion about what ROI means in the open source context and how we can think about it based on some other people's work. So first, just starting with a quote about why this is important. I think especially now, given that finances are getting tighter, this problem of limited evidence is actually becoming more acute. So this is from an article authored by Path that was published in DevX recently. More evidence is needed about the sort of value of these investments. Just to start off with a couple of terms, return on investment and cost benefit analysis. I'm sure most of you are familiar with these already. They are definitely related. I'll just use them a bit and just putting them up here so we have a sort of a ground level understanding of what we're talking about. But obviously, return on investment, to be able to calculate that, you need to know what you're getting out of your investment and what you're putting into it. And the cost benefit analysis is similar. You do that to analyze whether or not you should invest in something. And here's just an example from the same article of why we might need this kind of cost benefit analysis. So given that a health program has $1 million, they have to both deliver the actual health service and they probably want some sort of information system to collect data about it. How do they balance those two costs, given that the amount of money they have to spend is finite? So you only have X number of dollars. How much can you actually spend on data given that kind of scenario? And I would say that there do exist methodologies for calculating the costs and benefits of direct health interventions like health services, vaccines, et cetera. But so far, the cost of information systems is, I think, much less explored and much less thoroughly theorized. So we do have a lot of sort of path-breaking work to do if we want to do a good job of having a really robust system for analyzing that. But it is important. So this is from a WHO about the value of digital technologies for health. And I think they also have a good advocacy piece about why it's important to invest in routine health information systems. But they also note that it's complex and continues to evolve. And so even analyzing the field right now and saying what has it cost to build these systems does not necessarily reflect what it will cost in the future, given the changing nature of technology and the changing needs at the country and international level. So it's not a static problem. Okay, so in the previous slide in ROI, I didn't really talk about this, but there's a concept of social ROI, which takes into account non-economic factors. And that's really kind of the domain we're in when we're talking about DHIS2. We're not actually getting a return on investment in an economic sense. We're getting other kinds of value from what the systems are doing, whether that's efficiency gains, whether that's positive health outcomes as an indirect effect. So the two things we need to be able to understand to get to an ROI are what are the costs associated with DHIS2 and what are the positive impacts for the value of DHIS2. And so my goals in this presentation are to share some ideas and some approaches that we've seen so far, and then help contribute to this dialogue and bring this work forward, because I think that this is something we're all being asked to do more of. I'll start with the simple part, which is the national level, and relatively simple. So here, when we talk about what the cost of DHIS2 is per country, we have to acknowledge that even though DHIS2 is free to use, it's not actually free to use because you have to implement it. As Busoye pointed out, there are a ton of costs related to that do change over time. There's all this infrastructure, this internet access, these devices. There's the implementation work, there's the training work, there's ongoing cost. There's all the people who are actually doing the work of entering data and then analyzing the data. So there's this whole sort of network of stuff that needs to be paid for and people who need to be paid in order for this data to be collected and used. And so that's kind of the holistic cost we're talking about, which is more like a cost of data, not necessarily just the cost of the DHIS2 system itself. And calculating ROI is usually a point in time calculation, but in order to do that, you can think about it in a chunk of time. So this return on investment might be a 3-year window or a 5-year window, and depending on the phases of the project, we do see that cost change over time. So the implementation phase, the design phase may be a significantly higher cost than the operational phase. And sort of thinking about that time scale when actually doing this calculation, so you get an accurate picture. And the same would be true of the return. Over what time scale are you calculating the benefits from that system? And usually you'd also want to make a comparison to the cost of doing something else. So it's not just the cost of a DHIS2 system, but what would you do in the absence of DHIS2? Would you have no system? And then what does that mean as far as efficiency is concerned? Would you have some bespoke system or some licensed system? Those also have costs that you'd have to calculate to make a fair comparison. So there are some examples of groups that have tried to do this. Digital Square produced this total cost of ownership tool for open source solutions. So I have the link up there. And they also have a sustainability calculator, which attempts to calculate this over time. I think this is useful, and they did have an article or a supplement for Oxford Open Digital Health that has some examples of countries using this model to calculate the total cost of ownership for a variety of different open source tools. So if you're interested in this topic, I recommend you to check that out. But this is not really getting us to ROI because it doesn't talk at all about the value or the benefits. It just talks about the costs. But that is one side of the equation. So it could be useful to look at this as a resource. It also doesn't really talk about the network effects. So Scott mentioned this in his talk, that the value of DHIS2 and the cost of DHIS2 is not just per system or per country. It's actually affected by this entire network and ecosystem. And so the cost of DHIS2 per country is necessarily lower than something else that might be a single country implementation of something. And the benefit is also magnified greatly because of that. Another conversation we had recently was with the BSEPS team from the University of Bergen. And so they developed a tool that helps countries to calculate the costs and benefits of their health programs. So this is a really interesting tool. It allows them to prioritize things against each other. So if again, you have X dollars and you want to make the maximum benefit of those dollars for your population health, how do you choose between an antenatal care program, an HIV program, a diabetes program? Super interesting work. It does not currently contain anything about information systems. We did talk to them about that, and they were very interested in working with us potentially. They didn't have time before this conference, so we don't have any results yet, but hopefully we can actually make that collaboration happen. But I think really interesting as a way to contextualize, again, the sort of balancing costs against each other and trying to balance benefits. So there I want to transition into, having looked at some frameworks that exist, what have we actually seen groups and countries do so far to try to calculate return on investment for DHIS2? So this is an example from that special edition that used the TCO tool from Digital Square. This is the Kenyan National Cancer Registry. So they ran this cost estimate. They did group facilities into 3 categories of high, medium, and low cost. They had some interesting findings, like the operational costs being lower at the higher volume facilities, which they thought were due to economics of scale. And they also listed a lot of perceived benefits from stakeholders, which you can see here: reduced time and research requirements, improved data quality, enhanced reporting speed. They didn't really quantify these, unfortunately, so it's hard to, again, do that sort of numerical ROI calculation. But it does seem like in their analysis, it was a positive ROI. But again, the question is, how quantified does it need to be convincing? Like, is this convincing because they did a detailed review of costs and they also have a qualitative review of value or not? I think the answer to whether or not that's convincing will depend on who you're talking to ultimately. This one is a bit more concrete. It's from Botswana. This is from a report published by USAID from the Global Health Supply Chain Program. So this is using DHIS2 for logistics management, basically. They have a few good quotes here about how leveraging an existing DHIS2 system and adding logistics to it helped to reduce costs and also helped to be more efficient for getting the workforce on board because they already knew how to use DHIS2 from their health work. And then they have some really concrete comments here about the comparative cost of this system versus using a proprietary tool or like a robust ELMI solution. So a total cost of $55,000 for implementation with no subscription fee versus $5,000 a month for Power BI, or versus $2 million for, I didn't really specify there, but for a purpose-built ELMI solution. So that kind of analysis, at least, it gives you a comparison of what you need to do without DHIS2 to get a similar functionality. So that's one avenue, I think, of approach that can be promising. And this last one I really like. This is from ICRC. This is from their recent, again, logistics project, where they designed a last mile logistics tool for DHIS2, which they then used in 12 countries. And here they have a lot of really interesting findings about sort of workforce improvements, reducing stock ordering time from 4 hours to 30 minutes, 30% of savings of stock value per site through reduced wastage, efficiency gains of 10 to 15% per year per resource. Resource in that context means a person. So that person's able to work 10 to 15% more efficiently. So then you have salary savings. And this one I really liked, which is then turning that into a calculation of reduced CO2 emissions for, we're now thinking a lot more about climate change and thinking about how that relates to digital systems. So being able to turn this kind of efficiency information into also a carbon calculation is, again, something I think is really interesting in our current context. And then they actually did a full ROI calculation of this based on the amount they paid to have the system developed, and found that over a 5-year period, the ROI was 254%, which I think is pretty good. So we have published something about this on our website. And they also did then share this tool open source with the entire DHIS2 community. So this is now part of the global DHIS2 platform. But this is the kind of calculation I think we would really love to see from organizations that are working with DHIS2, because it shows that they're thinking pretty deeply about what they paid into the system and what they're getting out of it. And this is, I think, to me, is a compelling case from a neutral party, not us doing our own analysis, that shows that they've actually run these numbers and they've found it to be a very positive return on their investment in the system. So here I've tried to abstract this out a little bit to try to map out, a framework for thinking about some of the costs, some of the comparisons, some of the benefits, and then some of the more like network benefits from the DHIS2 and HISP network. Again, I'm not an economist, so if anyone out here is and think this is not a good diagram, you can let me know afterwards. I think this is just a sort of a way to start to make these comparisons ourselves and think about, if we have a project we need to justify in some way or need to analyze, what are the key parts of that analysis we should think about, and where can we actually get data, and then how do we arrive at a kind of rough ROI. And then looking at the country level, I think the big gray box in the corner, this is the question that then links it to the global platform and the global question. Who is actually paying the cost of the DHIS2 system, given the software is free? It's free to countries because somebody is paying for it, but it's not the country that's paying for it. So I think this is where we get into the global question of, what is the value of the global platform and how is that paid for? So it's just, if we were to then try to calculate this value of the DHIS2 platform per country, there are different ways we can think about this. Is it the total platform cost of DHIS2? Is that then multiplied by the number of countries using DHIS2 in some way? Is it based on the development maintenance cost of the features? Do we look at those features individually, since DHIS2, as Basoya pointed out, can be used for a lot of things, and to replace it, you might need actually several software platforms instead of one software platform. Should we calculate the cost per user of DHIS2 globally, per beneficiary of DHIS2 globally? These are a lot of things that we don't really have the answer for, and I think it's quite complex. So if we go into the next slide here, this is from a paper that Scott shared with me, actually, which is an attempt to calculate the value of open source software in general. And I've summarized that a little bit. But the main question is, like, what is DHIS2 and HISP worth? And And that's both to the countries and organizations using DHIS2 locally, and also the global and regional organizations that are investing in DHIS2 that benefit from the data that is produced in it. And what it would cost if the private sector had to recreate DHIS2. So they were looking not just at the value of the core software and supporting resources, but also the general ecosystem around it, and the value of its ability to be extended and integrate with other systems. And the same for the HISP network. Is it more or less cost effective to work with them or hire private consultants in each country, is given the ongoing, so that somebody needs to do the kind of work that they're doing. This is also the kind of cost comparison we can make. So going back to the paper that I took that quote from, and this is an attempt to calculate the value of free open source software. They note that it's difficult to measure the value of OSS due to its non-pecuniary nature and lack of centralized usage tracking, which I think sounds very familiar to us in the DHIS2 context. We don't actually have any really, really solid data on how many users of DHIS2 are there in the world. I would love to get that information because I think that would make our ROI case much more solid. But the important point here from this paper is they look at two kinds of values, supply side and demand side. So the first is what we usually calculate, which is how much it does cost us to make and maintain the DHIS2 software. And that's a pretty low dollar amount. They also then look more importantly at the demand side of the software, which is how much would it cost others to recreate the software. And the important point there is that the supply side is a one-time cost because it's one organization making the open source tool. The demand side is times the number of countries or number of organizations that are using that software. Because if it wasn't open source, each of those organizations have to get that tool themselves, either by making it themselves or buying a license for it themselves from another provider. So in fact, well, it might cost us X million dollars to make and maintain the DHIS2 software. If it's 100 countries using it, that number is not quite times 100, but it's more or less that. It's a, order of magnitude greater than what it costs us to do it as open source provided for free than it would be for each of these countries to source it themselves. So they say our results ideally add weight to arguments that users of OSS should not just free ride, but contribute to the creation and maintenance of OSS. Such contributions are a fraction of the costs that firms would incur if OSS did not exist. So here again, similar diagram, trying to make these sort of calculations and arguments on a platform level for DHIS2. This has all been kind of complex and academic. And I'm going to close this out reflecting on the process of thinking about this and discussing it with people, including our investors, including some people who have worked in some of these projects before. We were talking to the BSEPS team, one of whom is Austin Davis, who's a good longtime friend and supporter of DHIS2 and a good critical voice. And one of his comments was that this is all very complicated and it might be easier to just say, this is how much money we think, or this is what percentage of a budget we think data is worth, and use that as kind of a rough value that should guide the investment, rather than try to engage in this very complex process of calculating things from all these different variables. And here, the way I summarize that is basically the amount of effort necessary to thoroughly calculate the ROI in all this is significant. I'm not an economist. Nobody in our team is really expert in this. In order to do this kind of work, which hasn't been done before, as far as the research we found, we would need to engage in this really complicated research project and then generate a lot of data, collect and analyze a lot of data to make that a real legitimate calculation. In comparison, the cost of maintaining DHIS2 and HISP is comparatively low. And we're talking about $15 million per year to the core team to produce and maintain the software, plus or minus, that's a 2024 figure, and then additional $5 million from central level down to the HISP network. So the question then becomes like, is all that effort of doing the ROI calculation more cost than the benefit we get out of it, given the low cost to just continue to do the work? And I think that's a question that's worth thinking about. So I put Austin's suggestion there. He had his back of the envelope kind of figure about what percentage of data, what percentage of budget should go to data. There's a similar case made by this Global Partnership for Sustainable Development Data. They had slightly lower figures from their percentage, but it might be a different denominator they're working from. But I think that's also something to think about from an investor perspective. Where is the money well spent? And if you have something is working and is returning on your investment so far and is providing good value, where do you direct your resources, and where's the line between trying to arrive at a good enough ROI and a perfect ROI calculation? So that's the way I guess I want to close this. thank you, and open for questions. So we do have another 10 minutes-ish. So if people have questions, I think all of our speakers are happy to answer, or if you have other ideas too, I think not just questions, but suggestions or experiences for how to think about this.
Thank you, guys. It was really good to hear you. As someone who has this kind of calls rather often, one question that I've been wondering for a while is do we have an overview of other platforms that are in similar spaces and their costs? And obviously, it's impossible to compare like to like because it's very different and there's many possibilities. But do you have any examples or have we done any market research on competitors? Are we allowed to call them competitors? I don't even know.
Well, it depends how the framing is, if they're competitors or not. I don't like to think of anyone as competitors anymore because that just undermines the whole point of DPGs to some extent. But yeah, no, we have looked a lot at that. And I want to emphasize your apples to apples comparison analogy issue. There is nothing that is the equivalent of DHIS2, right? Most of the other DPGs would be like basically one app within the DHIS2 ecosystem. We can argue the point.
I'm not thinking about DPGs here. I'm thinking about commercial solutions that charge for registries, for aggregate, for, functions that we already do.
Right. Okay. That's a fair point. So, but to my other point, so like most of the other DPGs, they would be like one app. And so we get this really false analogy being like, oh, DHIS2's cost is so huge compared to these other products that are operating also in this space. Well, it's actually because like DHIS2 is, the equivalent of an order of magnitude larger than that product, right? That one single other solution. And so a big part of what we're trying to do is saying, let's not make apples to apples comparisons all the time. And we're very, very good at doing that. Our default behavior oftentimes is like, okay, DHIS2 next to ODK, next to ComCare, next to blah, blah, blah. That's not a fair comparison. Then I can speak a little bit on maybe what people who are brand new to DHIS2 have expected to pay for it and sent us some budgets. There's one I won't name names, but we got a budget from a higher income context quite recently, and their entire budget template was in base millions of dollars, 17 rows, and our stand-up costs for a DHIS2 server that we had to put in for their launch costs in this millions of dollars was $200, right? So we had to put 0.002 in, and we were told this is like laughably low. Like they won't take this seriously. Like we could have just immediately been like, oh, this is a joke. So the expectation in many places is that you pay a hell of a lot for these kinds of things. I mean, there are budget lines like platform fees, service fees, these kinds of things. We just don't even have those, right? And this is a bit of an adjustment. I think in the developing sector, there's an expectation that has been set by how much people have paid for DHIS2. And outside of that, it's a completely different world. And the expectation is, way different. I don't know if that answers your question, but yeah.
Well, I've been involved over the years with this attempt to evaluate the cost of digital as a health intervention. And that often seems to be that, especially from the public health side, what they want to be able to quantify is should they be paying for a digital solution versus how much they could spend on medicine. And that's the one where I think it's just a nonsensical way to talk about this. And it's purely an academic kind of mind game, really. We ran into, we tried working with an economist from the London School. We tried working with an economist in DC, like multiple times projects that I've been on have tried to do this kind of thing. And I really hope that we're maturing past that question. There's no thought that you're going to run a health program without data. So we don't need to talk about whether or not to invest in data versus medicine. You can't have a supply chain. You can't be providing medicines if you don't have data. So I do think this comparison that Enzo was bringing up of, okay, well then, given that there's going to be a data system, how much does it cost to do us versus another versus another? And that, I think we could do some work on that. I think it'd be really interesting to reach out to the Harvard Business School people that wrote about the value of FOSS and talk to them about our scenario and see if they want to write a bit about it.
I did. They didn't respond to emails.
All right. Anybody have connections to the Harvard Business School? Let us know.
Yeah, there are other struggle bus too.
I know, but this might be a thing they'll be willing to stand on. Yeah. All right. Enzo does. Anyway, that's just my thought, especially it's again, it often feels like a false dichotomy. We're asked to justify why spend money on it. And that's not really the question. Money is going to be spent on it. So it's just figuring out how much and what can be done to optimize it. I loved your examples, Besoya, about how to reduce the cost for implementation, because also we're talking about countries being able to eventually pay on their own. All of that savings is super important when you're in a constrained environment. So yeah, I'll stop there.
We do have a couple comments online. I'll just read those. Monica Lopez Boiro says, we compared a Salesforce system to the DHIS2 customized instance. For us, the decision came down to our ability to have flexibility in the number of users. So there are some comparisons where it might be a similar cost, but different functionality or flexibility. And then Mohammed Bania, they wrote to say, Salam colleagues, I would advise mixed methods approach to ROI assessment, since it reflects the local context and cultural issues, which is not measured in USD only. And he meant a qualitative approach. I think that's sort of similar to the SROI that I mentioned in my slide, that it's not just about monetary value, but also the social value. Any other comments, questions?
If no one's going to say anything, I got one other thought. So as Scott has mentioned a couple of times, we've been reached out to quite a lot lately from high income countries, high income settings, high income sectors, and they are not reaching out to us because DHIS2 is free. In fact, they don't care about that at all. What they care about is that it's an open source system that they can own, not have vendor lock-in, be able to switch between, have the system grow over time. In fact, they're quite happy to pay for it and wish that we had a standard line item license that they could just do their normal procurement to make it make sense. Rather, they're calling us and saying, how do we procure this? Because it's free. Like, we don't have a method to do that. So that is a thing that we're working on, is having a way for them to procure. But I think it's valuable in this context to talk about it, because we make a lot of emphasis on the F part of FOSS, and it's really free. It matters in low and middle income country settings where we're working. It matters for what we're trying to achieve with the SDGs, but it doesn't really make the sales case elsewhere, because they all expect to pay for it.
It's free in terms of access, but not free in terms of like free beer. Is that what's the quote? Freedom, yes. Free in terms of freedom, not free as in terms of free beer. Although we do often have free beer.
Good afternoon, everyone. My name is Chinazo from Nigeria. So we've had this conversation yesterday. So I just wanted to also add that, can we adopt some models that certain open source use, like ODK and Kobo Collect, where we kind of push the expenses to the users so they can install, okay, the cost of deploying, they can set up and then deploy. That way they're paying for the cloud infrastructure, the data warehouse, they can set that up from their end. But if they want to use that of DHIS2, they can now pay for it. Otherwise, it could be a desktop application, and if you want to deploy to the web, you can set up similar to what ODK does. ODK is free, but your data storage, everything, you set it up yourself. So that way, you're not exactly billing them, but I mean, they now have to pay for it. And especially since the data is just expanding and expanding and expanding, they now understand the implication and they can better manage it and use some of the ideas you shared, because now they're paying for it and they know how to optimize and reduce what is not necessary.
Yeah, it's a really good question. I want to, it reminds me of the time. So ODK, Open Data Kit, been around forever. Huge implementations, right? And you and the team who runs ODK have struggled desperately. It's the biggest tragedy of the commons example I can think of. And I was talking to him last year, the founder of ODK, and he said the best thing he ever did was to put up paywalls and barriers. Right? And he was like, yeah, we have a lot less users, but at least someone's paying for it now. And I think that we're desperately trying to avoid that. We're trying to do everything we can to figure out everything about DHIS2 that we produce is open, freely available, and accessible to anyone at any time. Now, and maybe Basoya, you might chime in with this one, but as an organization, you can have complementary services on top of DHIS2, and those do come at a cost. And a big part of what we're trying to establish now are modalities and mechanisms for you to be able to share some of your revenue for the services that you're building on top of DHIS2 back to sustaining the core.
Yeah, just a kind of a thought as it comes to my head. One of the things that's so great is seeing the creativity and innovation in this model of operating. And so really capturing the fact that people are paying in their in-kind time by innovating into and giving back. Any calculation you do should really include that in-kind time that people are paying forward.
Yeah, I would just say that did come up as one of the topics in the FOSS paper that the Harvard Business School worked on. So definitely.
Yeah, and we're definitely, when we're talking about contributions, we're taking a fairly broad stance. Of course, there needs to be financial contributions, but the time that you spend fixing code, contributing bugs, providing insights, this kind of stuff, these are super valuable. And in fact, our own research shows that user stories posted to community practice are probably the most valuable thing to the broader community, right? To everybody, strengthening and it's almost impossible to quantify. I keep going back to this one example where Sri Lanka, one user story, 60 countries adopted what they did. They use it as a foundation. It's almost like kind of like a miracle. It doesn't sound believable, but it's what's happening. And and we're really struggling, like from a methodological perspective, just to figure out how to come up with that. But to your point, those kinds of contributions are valuable and they need to be recognized. And we need to figure out some means of quantifying them and attributing them.
All right, I think we have time for one more question or comment. If anyone has something they want to add. Yes.
Yeah, I don't know if I have any insightful economic response to all of this, but I'm just really encouraged by the fact that you've done this, trying to pull out what exists. And I recall some kind of comparison back in time between DHIS2 and other digital solutions originating within the university sector. So whether you compare apples and pears, that is interesting because it comes back to the University of Oslo and that it's funded somewhere with an academic base. So the value of DHIS2 from research, action research, for example, and insights will not be possible to calculate, I think. And another thing, NORAD as a funder is, of course, interested in return on investment, but those kind of calculations hardly ever calculate in the long-term return on investment. So the timeline is usually much too short to really know whether or not it's worth investing in, and the maintenance costs and all that. So So I would say just the awareness around the costs issue is nearly as important as the results of all those studies. So thanks a lot. I appreciate it.
Okay, and I think with that, we have to wrap up. Thanks everyone for joining us. It's been, I think, interesting to hear more about this, interesting to hear all of your thoughts. And if you have more questions, feel free to share them with us afterwards. And for now, we are free to go and enjoy the networking session and enjoy the rest of the conference. Thank you.